Good afternoon, good morning to some of you. Thank you for joining our Choices Community of Practice November coffee chat. I'd like to mention this is our final coffee chat of 2024. So I just want to say thanks to all of you who've been joining all of our events this year and really over the past 4 years now that we've been hosting these events. It's really because of your interest and engagement that we put on these coffee chats. So we really appreciate all the feedback from folks. And we are really excited, looking forward to continuing to offer coffee chats in 2025. So looking forward to seeing y'all again in January as well. So the topic for today's coffee chat is cost-effective strategies to create healthier environments, a walkthrough of the Choices National Action Kit 2.0. My name is Molly Garrone. I am a Senior Communications Coordinator for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. School of Public Health. And as usual, I will be moderating today's discussion. I'd like to take a moment to acknowledge our funders who make this work possible and share that our Choices work and events are only for research and educational purposes. The intention of today's coffee chat is to provide information, tools, and resources to inform and educate. We are not looking to influence any specific legislation. I also want to note that myself and our guest speaker today are sharing personal perspectives, and we do not speak on behalf of Harvard. If you are unfamiliar with the Choices Community of Practice, we are a network that includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. And our coffee chats are unique opportunities to share ideas and enhance connections in an informal setting. Today, we will start by hearing a presentation from our speaker, and then we will open up the floor for a full group discussion and Q&A, but please do feel free to share any questions or comments in the chat at any time throughout the event. Today's coffee chat will feature a walkthrough of how to use the Choices National Action Kit 2.0, which is an interactive tool for comparing the cost effectiveness and health equity impact of policies and programs that promote healthy eating and active living. We are looking forward to hearing from our guest speaker about how to use the action kit and the key metrics that can be compared as part of the tool, and also where to find more detailed information about a strategy to support the planning and prioritization of health promotion efforts. So we are thrilled to be joined by a member of our own team, Jessica Barrett. Jessica is a Senior Research Analyst at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. School of Public Health. For the Choices Project in particular, Jessica oversees computational cost-effectiveness analysis modeling protocols and provides technical assistance on calculating, interpreting, and communicating cost-effectiveness results with state and local health agencies. She led the work to update the Choices projections of strategies nationwide and display the results on the National Action Kit 2.0 website. So welcome, Jessica. We are really excited to have you here to share all about the Action Kit. So without further ado, I'm going to pass it along to Jessica.
Thanks, Molly. And thanks everyone for joining. And I guess I'll also thank those who have gone to the Action Kit already. And like Molly said, for those who haven't, you are definitely in the right place because I'm going to give you the tool you need to get started. So I'll start by describing, can we move to the next slide? I'll start by describing some background information about the Choices National Action Kit and then walk through the kit and what you can do with it. So just for a little background here, Choices looks for policies and programs that can improve physical activity and nutrition environments and deliver the best results for the dollars invested, focusing on improving both population health and health equity. Next slide. The Choices National Action Kit 2.0 is a key resource that displays projections of the national population reach, health impact, and cost effectiveness of strategies to improve child health across 4 settings. This tool is a relaunch of the Choices National Action Kit, which was originally released in 2019. The National Action Kit 2.0 includes updated cost effectiveness measures, more detailed information on costs and impacts that strategies could have on health equity, and it has an updated look and feel and usability of the tool. Next slide. On the Choices National Action Kit, you can compare strategies, and you can also explore strategies in more depth. So you might want to do either or both of these things, depending on your goals and your interests. When you compare strategies, you can answer questions like, which ones have the biggest impact? Which are cost effective or cost saving? Which are the least expensive to implement? And then some questions you might want to answer if you're exploring a strategy in more depth are, what are the activities and resources needed to implement the strategy? Which activities cost the most to implement and who's paying? And what are the impacts on health equity? In the next slide, I'll show you why you might want to use the action kit. So you can use it to do a number of things, to identify the cost-effective and efficient implementation strategies, to explain the impact on the population, to provide evidence for action, guide resource investment, to cultivate alliances and support, and to integrate health equity considerations into all of this. On to the next slide. The kit is an interactive tool, and so today I'm going to walk through how you can use it. So I'll start with a walkthrough just to show you how to navigate the kit and what features are available. And then I'll go through how to explore strategy in more depth using a strategy report. And then finally, I'll demonstrate how to compare strategies using the comparison builder. Let's get started, and we can first walk through the kit. The Choices National Action Kit 2.0 tool can be accessed via a direct web link or through the resources menu on the Choices website. The kit displays a menu of strategies for which the Choices team has projected the national population reach, impact on health, implementation costs, healthcare cost savings, and health equity. These are effective policies and programs that can be used in schools, early care and education, and out of school time settings, communities, and clinics. And the strategies are color-coded by setting here. Choices focuses on effective strategies that can improve nutrition and physical activity environments, promote related health behaviors, and prevent chronic disease. The Choices team, in consultation with key partners and an expert advisory group, has identified strategies that have high quality evaluations and strong evidence for effectiveness for reducing excess weight gain or improving behavioral risk factors for excess weight, such as reduced sugary drink intake, increased physical activity, or decreased screen time. Some strategies presented in the National Action Kit have been implemented nationally already. These strategies, like the fast food restaurant calorie labeling shown here, are included to demonstrate their estimated impact and to inform ongoing or future policy updates. So the kit will allow you to compare up to 4 strategies at a time to help inform your organization's decision making around promoting healthy weight. So you can do that by clicking the select button for up to 4 strategies. So we'll pick a couple strategies in the school sector, movement breaks in the classroom and promoting water consumption in schools, and an out of school strategy for creating healthier after school environments, and a community-based sugary drink excise tax. So when you're looking at the strategies to select, you can click the down arrowhead to get a preview of a strategy, and that brings up its description and the projected cost per person, population reach, population health impact in terms of cases of obesity prevented, and cost effectiveness. The strategy selection page also has links to strategy reports for each strategy included in the kit, and I'll come back to those resources later. So you can click Build Comparison to see the comparison. And that's going to bring up a side-by-side comparison with the results for each of the strategies selected in a column. Note again, here you can click the strategy reports And projections are shown here on the comparison page for a number of key metrics, including the change in health behavior per person, cost per person to implement the strategy, the number of people reached, cases of obesity prevented overall and among children, health equity impact, quality adjusted life years gained, years with obesity prevented, and cost effectiveness metrics, including healthcare costs saved per dollar invested and cost per quality adjusted life year gained. Choices focuses on outcomes that are related to the prevention of chronic disease, specifically through the prevention of excess weight. And then all outcomes are projected over the model period that's noted at the bottom of the comparison page. Definitions of each metric are provided in the glossary, which is linked on this page. And then to learn more about Choice's methods, you can go to the methods page, which can be accessed from the glossary or the Action Kit comparison page, or from the menu at the top of the Choices webpage. So one feature to know about for the Choices methods is when you're using the Action Kit is how we account for uncertainty. Choices makes projections based on the best available evidence, estimating the effects of a strategy on health behaviors and on BMI using high quality study designs, as well as national and state data sources and evidence to estimate population reach and costs. To account for from uncertainty from data sources and population projections, Choices calculates mean or most likely outcomes in 95% uncertainty intervals, or the likely range. So uncertainty intervals are calculated by running the model 1,000 times and reporting the range of projected outcomes accounting for uncertainty. The Action Kit displays mean projections, and also the 95% uncertainty intervals can be displayed by checking the box at the top of the comparison page. And you can see what the comparison page looks like, both without and then with the 95% uncertainty intervals added. To save a comparison for future reference or for sharing with colleagues or partners, you can click the buttons at the top of the comparison page to export as PDF or to print. And with either of those options, you can customize the PDF or the printout to show just the metrics of interest to you and to show or not to show the 95% uncertainty intervals. By default, all of them are selected. And then the comparison can be downloaded to a location of your choosing or printed to a printer that's accessible to you. And here's what it looks like. It looks very similar to the way it's laid out on the web page. So those are the basics of how to navigate the Choices National Action Kit 2.0 website. For more information and to review the information that I just went through, you can explore the user guide. That contains information about how to use the Action Kit, as well as details about Choices methods, organized in a list of frequently asked questions. So on to the next slide. We'll get into exploring a strategy in more depth. To see more details about one particular strategy, you can refer to the strategy report. So you can get strategy reports from a few places on the website, and I think I've already gone through most of them by now, but first of all, you can get them from the Action Kit comparison page or the Action Kit strategy selection page. And you can also get them through the resource library, access through the resources menu. And here's an example. If you go to research briefs and reports, you can see a sugary drink excise tax strategy report. So the strategy report provides a comprehensive description of choices, projections, and assumptions for one strategy. It's organized into several sections. We'll look at the movement breaks in the classroom strategy report as an example right now. The strategy report includes a number of sections, including a profile of the strategy, the national results that are displayed on the Action Kit website, detailed cost results, health equity indicators, strategy details and modeling methods, the outcomes glossary that's available through the kit, and references for that strategy. In the first section that I'll highlight here, the strategy profile describes the estimated benefits, activities, resources, and leadership that are needed to implement the strategy. It includes a table listing the activities and resources needed to implement the strategy, and it links to research briefs summarizing choices projections for the strategy in state and local areas. This information in the strategy profile can be useful for considering how the strategy might be implemented in a state or local area. I'll also note that standalone strategy profiles for strategies included in the National Action Kit and more are available in the Choices Resource Library. Going back to the next section I want to highlight, in the cost results section of the strategy report, the estimated costs to implement the strategy nationwide are displayed, and they're broken out by the same activity categories as in the strategy profile, and they're broken out by payer. This shows which activities are projected to incur the greatest share of costs and then who's responsible for paying for them. For the movement breaks in the classroom strategy, you can see here that the biggest cost is estimated to be the time cost of training classroom teachers in movement breaks, and that comprises 77% of the total implementation cost. And then we assume that school districts are responsible for over 99% of the total costs. So they're paying nearly all of the cost to implement it. And you can see that in the table by payer. So that this information can be helpful for estimating how much it might cost to implement the strategy in a state or local area and who might be paying. You can get a rough estimate of the total annual implementation costs for a state or local area by multiplying the cost per person projected for the strategy nationally by the number of people that you might expect to be reached in the state or local area. The other key section that I want to mention here in the strategy report is the health equity indicator section. That describes the projected impact of implementing the strategy nationally on health equity by race, ethnicity, and income. Choices has found that several strategies are projected to both improve population health as well as improve health equity. The national projections of health equity impacts can give you a sense of how a strategy may impact health equity in a state or local area. And you also want to consider how the projections in your state or local area might differ based on the demographic and socioeconomic characteristics in the area, and also potential strategy implementation mechanisms and modifications. Through improvements in school physical activity environments and child physical activity levels, the movement breaks in the classroom strategy is projected to prevent 31,500 cases of obesity in the final model year. The strategy is projected to prevent cases in all race, ethnicity, and income groups, with larger preventive benefits projected among Black or African American and Hispanic or Latino populations and populations with lower household incomes. These results on health equity are displayed in bar charts, showing larger numbers for groups with greater preventive benefits, and they're also summarized in text and detailed in a table in the strategy report. In the strategy details and modeling methods section of the strategy report, it describes the assumptions that were used to make national projections for the strategy and provide links to additional resources related to the strategy. For the movement break in the classroom strategy, for example, this section includes the estimates and resources used to estimate how many public school children are reached by the strategy and what the effect of the strategy is on physical activity and BMI. Referring to these national assumptions can help you identify potential data sources and estimates that might be needed to plan implementation of the strategy in a state or local area, or that could be used to calculate rough outcomes for a state or local area. So now that we've looked at how to explore a single strategy in more depth, let's come back to the comparison page and talk about how to compare strategies. Next slide, please. And again. So coming back, here are the 4 strategies that were selected earlier, right? We have promoting physical activity through movement breaks in the classroom, promoting water consumption in schools with the installation of chilled drinking water dispensers in school cafeterias, improving after-school nutrition and physical activity policies and practices, and implementing a sugary drink excise tax of 2 cents per ounce. I'll talk about a few key metrics and how you might compare them. These are just some of the metrics that Choices projects that can be considered when prioritizing strategies for chronic disease prevention and the promotion of healthy eating and active living. The importance of any individual metric, along with other considerations for priority setting, may vary by context. So one metric that may be of interest to a lot of audiences is the change in health behavior per person due to implementation of the strategy. And for different strategies, the behaviors will vary depending on the focus of the strategy. So here, for the 4 that we've selected, there are projections for change in physical activity, water intake, snack calories, and sugary drink intake. So these are different, but for strategies that focus on the same health behaviors, you can compare the strategies. So for example, here we have both movement breaks in the classroom and creating healthier after-school environments. They both impact physical activity behavior. And we can see that movement breaks in the classroom is projected to have greater impacts on physical activity per person reached. So that's the health behaviors, and we can move on to look at cost per person for these 4 strategies to get a sense of how much it might cost. So looking across these 4, we see that the sugary drink excise tax has the lowest cost per person, while the strategy creating healthier after-school environments is estimated to have the highest cost per person. The 2 school-based strategies have similar, and I'll note low cost per person. And you can see more detail by clicking on the See Cost Results link to jump to the section in the strategy report for any one strategy. So now if we want to look at the impact of the strategies, we see that a sugary drink excise tax is projected to have the largest population reach and the most cases of obesity prevented of these 4. Creating healthier after-school environments is projected to have the smallest population reach and the lowest cases of obesity prevented. Among the 2 school-based strategies, notably, the strategy related to promoting water consumption is projected to prevent more cases of obesity than movement breaks in the classroom. All 4 of the strategies here are projected to improve health equity by race, ethnicity, and income. And you can click the See Health Equity Indicators link to jump to the strategy results, excuse me, to jump to the health equity indicator section in the strategy report for that strategy. And finally, last but not least, to compare cost effectiveness, look at the cost effectiveness metric, cost per quality gained. Again, quality stands for quality adjusted life year, and it's a measure of both the length and the quality of life. One of these strategies, the sugary drink excise tax, is projected to be cost saving. That means it's going to save more in excess weight related healthcare costs than it costs to implement. That's very rare, and it can be seen as a win win opportunity to both improve health and save money. The other three strategies require an investment to improve health. The strategy promoting water consumption in schools, for example, is projected to have a net cost per QALY gained of $35,000. This can be considered cost effective or good value for money at thresholds from $50,000 to $200,000 per QALY, which are commonly used thresholds in the US. Creating healthier after school environments has the highest projected cost per QALY gained at $154,000. While this strategy has a higher net cost per health improvement measured in terms of QALYs compared to the other three strategies that we selected, it could still be considered cost effective at a threshold of $200,000 per QALY. So that's the walkthrough that I wanted to go through with you today. And so to recap, I'm going to come back to the questions that we had earlier. So now these are things that you can do and questions you can answer by exploring the Choices National Action Kit 2.0 website. So for those of you who haven't already, we invite you to check it out. And thanks for listening today.
Fantastic. Thank you so much, Jessica. That was an amazing presentation, such a thorough walkthrough. I think it was really excellent how you went actually within the strategy report and highlighted for folks just how much information and data we actually have available on each of these strategies. And great to see you comparing different strategies and highlighting, which is the particular bang for the buck and all of those pieces. So really, really appreciate that. So I think one of the great parts of your presentation here was highlighting just the different types of metrics that we have available through the action kit. So cost, reach, cost effectiveness, health equity. So at this time, we're going to move into our full group discussion. So I want to invite you all to really think through any questions that you have here for Jessica about the action kit or any of the data, resources, modeling methods. So really think through any questions and feel free to put those into the chat or come off mute and ask questions. But I will get us started with one question for you, Jessica, that I already have here. So wondering if the Choices team plans to add more strategies to the action kit beyond the ones that are on there right now.
Yeah, thanks, Molly. So our process is that we will add any strategies that we have published after results have been published. And this is for any strategies where we've done evidence reviews and determined both that these are effective strategies based on high quality designs, and that we can feel like we can estimate the costs of a strategy. So sometimes strategy costs might not be available, and that can be a limiting factor. Or sometimes there are studies out there that might have some evidence related to the effect of a strategy, but they don't meet the standards of quality that we feel comfortable assuming. So those are some key things that we need to have in order to make projections for a strategy. And I will note that we have a couple strategies that will be added to the kit that aren't up there yet. And those are based on papers related to a healthy weight clinic in federally qualified health centers. So that's a new clinical strategy that will be added and is available in a paper. And then also an even more recent paper looking at a policy that's already been implemented nationally, and that is calorie labeling on prepared foods in supermarkets. So check back for those if you're interested in those strategies.
Excellent. Thanks, Jessica. Another question that I have here that was submitted in advance, what are some creative funding opportunities to support current and future public health?
Yeah, that's a great question. And I will say that there was a recent coffee chat from the Choices Community of Practice on braiding and layering funding. So that is available in the resource library for anyone who wants to dive more into this topic. Um, and so things that I'll note is we have some examples, particularly in the area of promoting water consumption in schools, where uh, places that we've worked with in Massachusetts and California, our partners in the state health departments there, have have looked at different implementation strategies that prioritize improvement in health and health equity, and have been the planned strategy implementation was based on linking with funding for school water infrastructure improvements. So that was, things like working uh, with existing grant funding that might be available and assuming that that would could be used to install water dispensers in school cafeterias.
Great, thanks, Jessica. And I just put a link in the chat to that coffee chat that was just a few months ago that you referenced there about braiding and layering funding. So encourage folks to take a look at that. And thanks, Jessica, for highlighting example. Another question here, any policy changes or maybe considerations to anticipate with kind of the new incoming federal administration?
Yeah, that's a great question. Certainly timely since it's on a lot of people's minds. So the need for chronic disease prevention has been highlighted in recent news cycles, and it's been a bit of a hot topic. And for one thing, we feel like the action kit um, can highlight lots of cost-effective and some even cost-saving strategies, including those that can be driven by policy changes. Um, and these would be strategies that would improve childhood nutrition and physical activity and prevent excess weight gain and chronic disease. So, the action kit can inform those conversations around policies, either at the federal, state, local level. Um, and I think another thing that I'll point out is that it is important to study and to estimate the impacts of existing policies. And we have some of those on the action kit, as I mentioned, because that can provide evidence for policies that have already been effective and cost effective at improving population health and health equity. And so that could be the basis of, informing the maintenance of policies if there are ongoing policy discussions or, proposals of rollbacks.
Great. Thank you, Jessica. I think that's such an important point that if anything, it's more of a time now than ever to continue, this type of work in cost effectiveness, but especially evaluating existing policies. I think that's such a great point. So I appreciate you making that. I do see a question here in the chat from Carol. Nice to have you on with us, Carol. Carol said, I'm thinking about the CDC state physical activity and nutrition strategies for fruit and veggie vouchers and prescription produce programs. Is this on our list of ideas to explore?
Yeah, that's a great question, and definitely a topic we hear about a lot in, with state and local partners. So thanks for bringing it up. We have explored with some state, local partners, I think, um, a SNAP related healthy incentives program. And so there we have looked at a local level and, perhaps could again look with some other partners at strategies within SNAP. And so let's see, there's a research brief available on our website for when we worked with Harris County, Texas, looking at what the estimated impact of a SNAP HIP program would be. We haven't looked too much at other types of prescription produce programs if you're thinking of other areas. But yeah, there's certainly still some emerging research coming out in that area on the evidence of the effects of those kinds of strategies. And so we'll keep our eye on that. And if there are high quality designs of studies that we feel like we could estimate in projections, then we always keep that in mind.
Yeah, great question. So another question I have here, Jessica. So what are some considerations for planning groups seeking to improve the built environment?
Yeah, thanks, Molly. So the built environment, that could mean a couple of things, and I have a couple examples maybe I can speak about. So one could be related to, the built environment for physical activity. And we have estimated uh, strategies related to safe routes to school with some of our partners in state and local areas. So we don't have that on the National Action Kit, but there are research briefs on safe routes to school in our resource library. And we have a strategy profile available for safe routes to school that, goes through the expected benefits and costs and resources needed for implementing that strategy. And what we found for safe routes to school is that, improvements to infrastructure in the built environment can be costly, and the impacts on health related to excess weight, where we're only looking at benefits to kids who are switching their behavior from, getting to school in a car to getting to school by walking or biking. Um, it results in small changes in excess weight prevention. So uh, that can be a challenge, but improvements to the built environment have lots of other benefits, right? Due to things like reduced vehicle traffic. So in our work with state and local health departments looking at safe routes to school strategies, we've estimated the impact and also the cost savings of those kinds of infrastructure changes and programmatic changes on reductions in injuries and crashes and reductions in pollution costs. And those are, usually messages that resonate with certain audiences, certainly in planning. Um, the other the other example that I'll come back to actually is if you're talking about the built environment related to nutrition, coming back to the promoting water in schools strategy, where there those strategies will be. We've estimated the impacts of strategies on students in schools. Um, but there are also impacts of those on the broader community, like the staff that are attending the schools. And so again, kind of a more holistic accounting or, a qualitative description of all the benefits um, of built environment strategies can really enrich the message and for priority setting.
Thanks, Jessica. Yeah, it's a great question. And the built environment is certainly such an important topic within the world of public health. So I appreciate you highlighting, even though Safe Routes to School in particular is not on our action kit, we do have lots of resources and examples of modeling that with other places. And I put a link in the chat to that, as well as a link to resources related to water in schools as well, which is on our action kit. So great question. So keep your questions coming, folks. I have a little bit more of a technical question, I think, for you, Jessica. But so you were talking, mentioned several times in your presentation about qualies. Could you talk a little bit more? I mean, you said what they are, but could you talk a little bit more kind of about qualies and why use them to set priorities to improve health?
Yeah, sure. Thanks for that question, Molly. And I think this also relates to that second poll where you all shared your responses about what what metrics you're most interested in, what areas, and a lot of people said improving population health was up there on your list of interests, which makes a lot of sense for this audience. But I'm assuming that, qualities and quality of life measures, they're not the typical kinds of measures that are being evaluated in public health practice. So it might be something that people are less familiar with. And the so one of the important consequences of excess weight gain and obesity is reduced quality of life and reduced life expectancy. So in a lot of decision science work and economic evaluation, and in our choices work, we estimate quality adjusted life years, qualities, that are gained from implementing a strategy. And that's a measure of how much the strategy could improve both the quantity and the quality of life for a population. And this can be useful information when decision makers have to prioritize scarce resources, because longevity and also the quality of life are agreed to be valuable health outcomes in society. So, choices is looking at strategies that are intended to prevent future excess weight gain and obesity, and that will lead to increased quality of life and qualities.
Great. Thank you, Jessica. So I think maybe just one last question here. So I know this is something that can sometimes be confusing for folks, and I do think you touched on it briefly, but some of the values in the results table in the action kit are noted as cost saving. Could you just speak briefly as to why that is the case?
Yeah, I can explain a little bit what that means and again why it's so important. So, choices projects that some policies and programs that are aimed at improving healthy eating and physical activity are cost saving. And that usually means that projections are showing that the healthcare costs saved due to reductions in excess weight from implementing the strategy, those would be greater than the cost to implement the strategy. So that's why as I said earlier, it's a win-win because you're both improving health and at the same time saving costs because of healthcare cost reductions. So those are, as I said, rare. Cost saving interventions are rare. And so if a decision maker hears that, that could be a huge win. And it provides an enormous opportunity. So yeah, look for those, but also not many strategies are cost saving. So that's why we look at cost effectiveness as the next best thing. It's a good value for money, and that's being defined by um, thresholds that people who study this in decision science have said. Um, this is an acceptable amount that we've agreed that we will pay for improvements in health.
Wonderful. Thank you, Jessica. I think that's a great point to sort of close on here, just underscoring that the strategies in the action kit, really the focus is on the, cost effectiveness and really the value there. But the added piece of, while it is rare, there are those strategies that are cost saving, though they are few. So that is such a key thing for folks to remember. So before y'all go, just a couple quick points at the end here as we kind of close out. So I want to remind everyone here, we do have lots more resources available in our community of practice portal. So you've seen lots of resources shared in our resource library, but there's even more in the community of practice portal. So we encourage you to take a look there. There's a member directory and other things that you can access. So please do take a look at that. As well, I want to note that there will be a little post-event survey that's going to pop up after this when you close out. So thank you in advance for taking the time to share your feedback. We really do appreciate it and take it into account for our planning. So thanks for your responses in advance. Again, a reminder, we'll be sharing the recording from today's presentation along with a little resource roundup, list of all the resources that we shared. So if you weren't able to capture everything, no worries, we will get that your way. And again, as I mentioned at the beginning, this is our final coffee chat of 2024. So just want to say thanks to all of you again who've been so engaged in these events over the past year and several years now that we've been doing these. So we really appreciate your continued interest and engagement. And we are really excited to continue hosting these again in 2025. So hope to see you all in January for our next event. And thanks again, Jessica, for the fantastic presentation.